Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Monday, August 10th.
August 10th.
And what are we, week 22?
We're week 22.
22.
22.
And that's been confirmed by our accountants.
Yeah.
Right?
That's right.
Who keep
our staff
track
accountants.
of every week,
They
right,
do.
that goes by.
Uh-huh.
I think they have a little line, like a jail cell.
They have to, because I started losing
Just
steam.
into the cinder block
everything.
wall.
Like
a jail cell. Like a jail cell.
Like a little Alcatraz, escape from Alcatraz moment.
That's how I envision our accountants.
Cool.
Back in the accounting room. So there you go. Welcome, everyone. We're glad that you are with us on this Monday program. We have a great show coming up to provide local information about COVID-19. We're going to be speaking with a doctor at the San Juan Health Partners Midwifery Clinic about women's health in the time of COVID and how that all works. And then we're also going to be speaking with an employee over at Basin Health Companies. And you know more about Deon Brown than I do.
I do.
Yeah, he's kind of in charge of cleaning everything, right?
He is the safety officer.
Okay,
so he's
that's
also
a much better title than what I had, the cleaning guy.
In charge of
I'm
cleaning.
sorry, Deon.
Yeah, no, he's a safety officer, and in fact, Deon actually fitted me out with PPE.
Oh.
So there's a whole thing about
The stories
that.
he could tell.
The stories he can tell, right, about me specifically.
Well, yes.
Yeah. She was the worst customer I've had.
You know, she's not really a medium. I don't know.
We'll
ask. Maybe
it's
we'll
very
ask.
involved.
Yeah.
I think it'd be interesting to go into that because
Right.
I didn't know all that was involved in that
Sure.
process.
Right. Which is why we're having him on the show.
That's right.
There you go. So there you are.
Yeah.
But let's start by
midwifery.
Midwifery.
Which I didn't know that
That's how you pronounce
was
it.
called. Right. I know about midwives, but
Yes.
the practice of midwifery, that's new for me.
See? Learn something new just by watching the show.
Or
hanging out with me.
I was going to say, or being a part of the show.
There you go. This is Nichele Salazar. Joining me now to talk a little bit about women's health during COVID-19 is Nichele Salazar from the San Juan Health Partners Midwifery and Women's Health Clinic in San Juan County. Good morning. Thank you for joining me.
Thank you. Thank you for having me.
You bet. It is great to have you on the program to talk a little bit about women's health and maybe some of the things that you are seeing at the clinic from local women who are coming in. Again, we keep hearing from our medical professionals that folks maybe aren't following up with doctor's visits and maybe letting things go on without talking to a physician or going to see their doctor. Is that something that you're seeing in your practice as well?
Yeah, we're definitely seeing a lot of that, and we're seeing a lot of issues that are related to the changes that COVID has brought upon us, like stress is one of the big ones. Dietary changes has been another big one, and it's affecting our hormones and our reproductive system. So we want women to come see us.
Right. And talk to me a little bit about that, because I think we all know during a pregnancy or leading up to pregnancy even, right, hormones can get a little out of whack and are changing during pregnancy. And so that plus stress during these times is probably not a good thing, I would think.
Yeah, definitely not. Some of the changes that we're seeing with the stress and the changes in the diet is leading us to having risks of like metabolic syndrome, obesity. So there's different things that we can talk about, maybe looking at diet and what are some changes we can make. Other things is like, even are they wanting to prepare for a pregnancy? Is that something that's a safe option? So being able to counsel them together, do some making definitely helps to improve their health and the baby's health if they do decide to have a baby. But it also helps to keep the families healthy, because if mom's healthy, then definitely, the family is moving in the right direction.
Right. Very true. And so what does that tend to do, though, to a woman who is pregnant? I mean, I know it's hard to maybe make a blanket statement, and every case is unique, but if a woman is stressed during pregnancy, does that cause extra stress on the baby as well?
It definitely does. They do feel that stress, but it also causes some hormonal cascades in the bodies too that can raise blood pressure. It can make you become more insulin resistant, meaning that you don't use the insulin like you used to, so it's a little higher, causes risk for gestational diabetes. There's just a whole bunch that stress can do. Sometimes, there's some research that says maybe it even causes the baby to be a little irritable to what comes out into our world.
Interesting. And so I would think then if I am having that stress and I'm going to give birth in a few months or a few weeks or what have you, then that, as you mentioned, isn't good for the baby maybe, and maybe not good for the others in my family either, I suppose, right?
Correct. The other thing, too, with getting care during this time is, okay, like pregnancy, you're always going to have some type of stress because your whole family dynamic is changing, whether it's your first baby, whether it's the second, third, fourth, whatever. There's always a little bit of change there. But now with COVID, there's different types of stresses that hit. So what are some ways that we can help? If somebody's having some issues with finances, can't put a lot of food on the table, then we know the resources available here in the community to help with that. If somebody's struggling mentally, usually we all have some type of tools that we use to help us through stress, and sometimes when that stress is just a little bit more, those tools aren't really helping, so we need to seek further assistance for that. So we have the ability to do referrals to mental health providers. We have the ability to use resources within our hospital, like our social service workers who can help get them into counseling. So there's a lot of benefits with prenatal care and well women care.
Right. And you mentioned diet, too. And I know, again, for stress, we may be eating things that are comforting, but maybe not exactly the best in healthiness for us. And so that can impact a woman, right, and can impact the baby as well if we're eating things that are a little bit less healthy for both of us.
Yeah. So it was pretty interesting when all this COVID started happening, and when I went to the store to go get some groceries, all the processed foods and foods that are high in preservatives were gone, but you still had a lot of the fresh produce and stuff that we should actually be eating. But it's understandable, during a crisis where they're telling you to at least have 2 weeks worth of food at home, what type of options we're going to go for. So because of that, we're seeing those changes in menstrual cycles. We're seeing women miss their cycle for the month. We're seeing women miss cycles for 2 months, or maybe they're having heavy bleeding that's longer than a week. So those things make a big difference. And I think a lot of people aren't really aware or don't really think that has anything to do with their reproductive organs.
Right, but apparently it does.
Yeah, it does. It's big.
And so, Nichele Salazar, I guess that coupled with the fact that maybe folks aren't feeling as comfortable as they should be to go see their doctor or go talk to their midwife or whomever is helping them during their pregnancy, can that lead to other, I guess, complications or potential problems down the road?
Yeah, definitely. Prenatal care and well women care are preventative. We're trying to prevent issues like whether, especially in prenatal care, issues with the pregnancy, labor, delivery, postpartum. So we want them to come see us, and we want them to know that we are taking precautions to keep our patients safe. We have a lot of new protocols that we're following. We're limiting the amount of patients in the office at one time, wearing masks, hand hygiene, taking temps, all of those. We're also limiting support people at the clinic too, so usually it's just one other adult that can be with you, but we are family oriented, so we try to figure out creative ways to keep the family involved. But we also want patients to know too that we understand that some may not feel comfortable coming in. It's a scary thing. They have concerns, but we can help accommodate them by doing maybe a virtual visit. We can do a visit, whether it's by video or whether it's by phone, and deciding if they have a concern that needs to be addressed right away, or maybe it's something we could have some options to try first and then bring them in later on for a follow-up. So we want patients to definitely call call us and ask us questions. What are our procedures? How do we keep them safe? Or do I really need to be seen right now, or can I wait a little bit?
Right. Sounds like there are some options then, potentially, for whatever's going on, right?
Definitely.
Very good. And pardon me, but are you also able to do video visits? Did you mention that?
Yes. We can do video visits or just telephone.
Got you. And for folks who maybe are listening this morning that maybe don't have a primary care physician or someone to help them and they're planning a pregnancy or those types of things, can they come and make an appointment or call the office and see what's available to them?
Yeah, they can give our office a call. Our phone number is 609-2590, and the ladies up front will help them get that scheduled. Quick little thing, too, about Well Woman exams.
Yes.
We also talk, do a lot of education and stuff like that, but we also help to, not just women's health, but we look at other things. We can do health maintenance labs to look at maybe risk for diabetes. We do STD screening, of course, but we can look at thyroid issues. Are they risk for high blood pressure? So there's so much more with health. We touch on stress. We touch on sleep hygiene. How can they improve their activity levels? Are there any intimacy concerns? Safety is a big one for our women too, and of course smoking cessation.
Sure, of course. And so it sounds like you've got services for women that maybe who are not currently pregnant or planning to get pregnant, but just any woman really of any age almost.
Yeah, I always say we're baby catchers and baby.
Oh, we missed the second part of that, I'm afraid. Repeat that for us.
I said we are baby and beyond. We definitely do more than just pregnancy and babies. Understood.
Well, very good. Well, Nichele, is there anything else that we need to remind folks about this morning as we talk about how COVID is impacting women's health and some things that women can do even short of coming to see you? Is there anything women can just do at home? I mean, take a few minutes to just kind of relax or breathe deeply or what have you when things are a little overwhelming, or what would you suggest?
Yeah, I think the most important thing is for women to take time out of their busy lives to take care of themselves. That's maybe 10, 15 minutes of just reading a book or just taking a breath, having an appointment, taking an hour to have an appointment to talk about all these things and what are some little things that she could do for herself daily. So my biggest thing is just to take that time to yourself and just regroup your mind, because our minds go 100 miles per hour. They're all over the place. Just read a book. That's probably one of the best things for me, at least, to regroup.
Sure. And I would think, though, that some women maybe feel that they are being selfish by taking time for themselves when they have maybe a family to care for, kids to care for, spouse, husband, partner to care for, all these different things that are pulling at them in 18 different directions, and they feel that they just can't do that and take time for themselves. It's probably not the best thought process, is it?
No, it's not. And that society has really set us up for some hardships, and that's one of the biggest thing is, I have to take care of all these things, but you can't take care of those things if you do not take care of yourself. So you really need to set aside some time and focus on yourself.
That's a very good point. You have to care for the caregiver before you can help somebody else. I've heard that before.
Yeah.
Right.
Yeah, exactly.
Very good. Well, Nichele Salazar, we appreciate your time this morning and visiting with me about women's health, especially women who are maybe pregnant or planning to be pregnant, and how they can have a successful and healthy pregnancy and just overall women's health. Thank you very much.
Yeah, thank you for having me.
You're very welcome. That is Nichele Salazar from San Juan Health Partners Midwifery and Women's Health Clinic, my guest here on KSJE. And we thank Nichele for talking with me, and people are probably wondering, why didn't you have the woman co-host as part of that interview? Where did you go?
Midwifery
Where did you go? I mean, thanks a lot. No, that was pre-recorded,
yes,
everybody. And so Megan was not available, and that's why I did the heavy lifting of the midwifery
Thanks
interview.
for carrying the team.
Yes, that's right. But anyway, but that was interesting, I think, of some of the points that she made about making sure women's health during this whole COVID time, that you don't forget about keeping yourself healthy.
Right.
So.
I mean, as she mentioned, pregnancy is stressful enough.
Right.
And then this happens.
Right, exactly.
So it can be very concerning. But, you know, I've had a lot of friends that have had midwives, and it's a very valuable thing to have.
Right.
Very valuable.
Yeah, there's a lot of training that goes into it. I know that.
Right. It's not just like some hippie. Who's
Well,
like,
I think
"Let me show you how to do it
originally
naturally."
a midwife was a little different than it is today,
For sure.
is my point.
Uh-huh.
So there you go. That's
Yeah.
what I learned.
That's really good. Yes. Yeah, that's good.
There you are. Anyway, our next guest is going to be calling in shortly.
Okay.
And in the meantime, though, we want to share some of the testing dates for this week from the Department of Health. Today, earlier at San Juan College, of course. Tomorrow, again in the evening at San Juan College from 6 p.m. to 7 p.m. New location, Wednesday, August 12th from 8 a.m. to 9 a.m. over at the County Administration Complex in Aztec. That's South Oliver Drive. Thursday, August 13th in the evening here at San Juan College from 6 to 7 p.m. And then Friday here at San Juan College in the morning from 7 a.m. to 8 a.m. So we want to just remind you about those. I'm reading those for our radio audience so they know where to go and what to do. And again, you're advised to register online, cvtestreg.nmhealth.org.
Do that.
Get all registered before you show up.
Yes, do
And
that.
you're good to go.
Makes it easier
Yeah.
for everybody.
There you go. That's true. So the other numbers, we can talk about those,
Yes.
right? You've calling up Johns Hopkins.
Yep.
And so
Calling him up.
Call him up.
I
yes.
called him up
Yes.
this morning.
There you are.
Hey, it's me again.
It's Megan
Feel like, oh,
on the
Megan.
Megan line.
Yeah, yeah. So the total cases confirmed in the United States: 19,902,316. The total deaths in the United States: 731,993. And
I think the 19 million is a worldwide number. Don't
oh,
you think?
I'm sorry. Gosh, yeah, that makes a lot more sense.
Because we're at about 5 million
Right.
in the U.S. As
Okay.
I look at the screen,
Oh, right. Okay, I'm looking at the wrong. Sorry, guys.
it's hard.
It is.
It's visual.
Well, yeah, of course.
And you're on your phone.
Right, they're not as U.S. centric as I am.
Understood.
They're covering the world. Okay, so the U.S. is 5,045,645.
Right.
That makes a lot more sense.
There we are. So
Cool.
got it. Okay. And then locally, again, from the numbers released yesterday by the state, from ksje.com, we are at 22,315 in New Mexico. That's an additional 205 yesterday. There were 5 new cases in San Juan County announced yesterday for a total of 3,044. 4 additional deaths statewide, and one death was in San Juan County, and that was, I think, a woman in her 30s with underlying health conditions who was hospitalized. So, and 57 new recoveries for a total of 9,319.
Gotcha.
So there's that. And the other stories, again, there's the state numbers, the Navajo Nation numbers. Again, they're at 9,103 after 35 new cases on Sunday, 1 additional death on the reservation, and that's the stories from the website there.
Gotcha.
And the other one's older, so we won't talk about that one. So there you go.
Only the most recent news for you, ladies and gents.
That's right. It's very true. So should we go to our next
Yes.
guest? Very good. Good morning. You're on KSJE. Thanks for calling in this morning.
Hi, good morning, Scott.
Hi there. This is Deon Brown, correct?
That is correct.
Okay. From Basin Health Companies.
Yes, sir.
Very good.
Very good. Okay, Deon, I asked you to come on because you're the safety dude over there, and
Really, safety dude. We talked about this just a few minutes ago.
safety officer.
There you go.
Yes, and so you had mentioned when I was getting fitted out for PPE, which I do want to cover that because that's such an involved process that I had no idea was a thing. But let's talk about Basin Guard. Can you give us just give us the rundown on what that is?
Sure. So I actually like to first just kind of introduce myself. So
Yeah.
I come from an emergency medicine background. We worked with the ambulance, and that's how I met Vince. We kind of got together and did the whole fire EMS stuff. And then when this pandemic started, Vince reached out to me, and we just kind of started talking, and we said, hey, yeah, because I'm a licensed insurance agent, and I specialize in the Medicare realm. So, you know, when this pandemic first started, we basically, you know, we're seeing all the older generation that was really getting affected by this at the very beginning. And so it had a special part in my heart. So, so Vince and I kind of started working. He asked me to be a safety dude, I guess, as our Rev says, is the safety dude. So
I hope you have business cards that say that.
Just started looking at some different ways that we could make sure that we keep our clinicians, our staff, our patients all safe and healthy. And so that's kind of how that all revolved. And we started searching and looking around for different ways that we could make better improvements on what's going on, with all the new CDC recommendations from OSHA and stuff. That's an evolving door, just keeps changing every day as we see. And we came across this Basin Guard, which is the actual MSDS name is Surface Guard 90. And so we looked at figuring out a way to do that, and we purchased it and became a wholesaler, and we created our own brand. So one of the Basin type families, we have Basin Home Health and Hospice and Coordinated Health and PALS, and so now we have Basin Guard on top of that.
Great. And so this is a spray, right? Like, tell us how this works. How long does it last? How many, who is the target audience for this?
So it could be sprayed, it could be wiped. The most effective way for this product to be applied is through a misting. And the reason it's the mist is because it allows for a larger surface area that we can take the concentrate to. So it basically, we purchased it in a gallon, and it mixes like 15 gallons to 1. It is FDA approved. This is not a disinfectant, so I just want to make sure that's very clear. This is something you just can't spray on and hope that stuff is disinfected. This is just a protectant, a barrier that lays onto the surfaces, porous or non-porous, and it creates a barrier. And so when the germs kind of fall down and land on the surface areas, they create spike that basically destroys the viruses and bacteria and stuff. So it can be sprayed either way, but the most effective way is through a mist.
Gotcha. And so the customer would have to disinfect first and then spray this.
Yes. So actually, the target audience, which you had asked earlier, is anybody from children, because now we're seeing an incline in the children's teenage people, and then as far as all the way up to the elderly and stuff. So the target audience is everybody. So but we can either go in and disinfect for you and then come back and spray the product for you, or we can allow you guys to clean it, and then basically we'll come in and spray it. And the other option is that we can just sell this to you, and you can apply it yourself.
And it said on I noticed the durability, that it was between 90 days or maybe even longer, depending on what surface we're talking about.
Yes, so it's recommended to do it monthly. It will last up to 90 days. And so the more high-touch areas, example like doorknobs and entrances, restrooms, the handles, that type of stuff, you'd obviously want to do it more often. But once you spray the barrier down, basically what you have to do is in between the spraying of the surface guard or basin guard, you just kind of do a normal wipe down and clean like you normally do. So it kind of cuts down on the cost of the disinfecting and doing that every single time. So it's really cost effective. You basically disinfect once, spray the barrier down, and then a couple days later, a week, you just have your staff or whoever does your cleaning and just kind of wipe down like normal. And then we go back, and it'll last up to 90 days depending on different surfaces. And so that's what's kind of cool about it.
Interesting. And so, Deon, I was just, you'd sent us a few graphics about this product, right? And so with some of these length of times, depending on how often a surface is touched. And so is that kind of a schedule that you follow there at Basin to add this to these surfaces?
Yes, sir. That's the recommendation from the CDC. And so basically what we've done is we just implemented that into our Basin Guard, and so that we can kind of keep on track. And we're actually developing some window cleans, kind of like, when you go get your oil change, you have this little decal at the very top, and it says that was done by so-and-so, and your oil change should be recommended, should be changed at this time. We're going to have window clings the same way as you kind of put on your window. We can spray cars, we spray offices. This product is really cool because in the wet form, it's an irritant, which means it just kind of irritates your skin and stuff. But in the dry form, you can actually eat off of it. So this is really recommended for kitchens and daycares, where kids are playing with their toys and stuff. We spray toys. So this is just kind of one thing, and we're getting ready to go into the flu season here in the next couple months and stuff. And so that's going to be another concern that we're going to have to worry about is we have COVID, now we have the flu. And so, with people being inside and being kind of contained to the inside during the winter months, that's where the germs and the viruses and all that stuff starts appearing, and you're more prone to get into it.
Right. And you mentioned that this is kind of providing or has an antimicrobial spike, right? And so I guess the only way to describe it to our listeners maybe is, you've got a balloon that's floating down from the ceiling, and it lands on a needle and it pops the balloon, and that's what this thing does microscopically with these viruses. Is that a good way to describe it?
That's perfect, and that's kind of how I explain it as well. Is think of the germs in a very microscopic version as a balloon, and then it's just you sneeze or cough or whatever, and they just kind of float down until it's airborne until it lands on the surface. And so typically what happens is when it lands on the surface, then it starts kind of building and creating a larger version. And so these spikes that are sitting up on the different surfaces basically just destroy that. And so it's like has to rebuild and stuff. It's kind of just deflated.
Got it. And Deon, you sent us some photos of some of this happening and being applied, it looks like, over at Basin, right? One of them's in an office. Can you talk a little bit about what we're seeing in that photo?
So yeah, that photo is some of our technicians that have suited up and is going around, and we've sprayed all our offices. We have offices in Farmington and in Gallup and Grants. We've even sprayed our entire fleet of cars, and so we basically just kind of take that, and so they're just it's one of the offices that they were spraying. I kind of took some pictures so they can kind of see and give you some versions and stuff, and so that's at our home health office.
Gotcha. But it can work on
another picture.
It could work on a surface, though, that has so much other stuff on it as well. I mean, you don't have to clean the entire desk off in order for it to be effective?
No. So that picture was actually post-spray. So you clean off the desk and you get everything all nice and clean and tidy and stuff. And so that was just one of those photo op things. While you guys are suited up, let's just take a picture of this for our marketing.
Okay. Well, that's why the logo is so prominent. I understand. All about the marketing. And then the vehicle, the other thing I wanted to ask you about was this vehicle, right? So obviously this works in vehicles and on fabric upholstery and seats and dashboards and all that stuff too, then I would assume, right?
That is correct. And so that's one of the nice features about this product is you can spray it on anywhere. And so it basically just creates a spike of barriers that when germs land on it, just kill it. And so if there's germs that we've missed when you've disinfected and stuff, they'll kind of just stay in between the barriers, kind of like the sheet, so you can't get through it and stuff. So, but yeah, we spray every surface that we can possibly spray with this.
Makes sense. And so switching gears a bit, because we had talked about fitting out for PPE. What is that process like? And the only reason I find it so fascinating is it's so in-depth, and we are always constantly worried about first responders and healthcare workers, and if given adequate PPE, what is the fitting process like?
So the fitting is actually it's an N95 fitting, and basically it's designed so that I probably told you when we were fit testing these, we're going to put you in the hood, and the hood is just basically just a area that will contain like a solution, and we use two different types of solutions. One's a bitter taste and one's a sweet taste, so it's very distinctful. And what the purpose is is that when you're in a N95 mask and you're being fit tested, and it properly fits you, is it basically secure or seals so that anything that's out there that's airborne goes through this filtration system, aka the N95. And so when we do a fit test on people, OSHA at the very beginning basically said, because of the pandemic, if you just have an N95, even if it hasn't been fit tested, use that just because. And we started at day one with this. When I came on board, we took all our clinicians, all our staff, and we properly fitted the N95s to them. So we actually know which N95 fits them properly. And so basically when you're in the hood, we spray the solution, and if you don't taste or smell that solution that we sprayed in there during multiple different tasks, then that mask is properly fitted for you, and it seals, and so it kind of protects you, gives you a better safety feature to it, I guess. And so it takes about 20 minutes or so to fit test each clinician, but it's just one of the things that Basin decided to do is because of our clinicians being out in the field and working every day. We just got to make the extra steps so we can make everybody safe.
Got it. And Deon, can you tell us if after the fitting, and maybe it depends on the job the person is doing, but is any of this PPE reusable, or is this kind of a one-time use situation? Because we've been hearing, of course, about shortages and having a hard time getting enough PPE for our frontline folks. So how does that work?
So we actually teamed up with it's Battelle, I think. It's a mobile reconditioning, kind of like an office per se out in Albuquerque, Bernalillo. And so they'll take the N95s that have been used. We package them up and send them down there to them. As long as they're not soiled, like makeup and that type of stuff, and not dirty, they'll recondition them, and we can use them up to 3 different times, have them reconditioned 3 times. And so that's really secured some of our PPs for our clinicians and stuff. So that was just another step that we figured out that we could do. And so we've been using that. But yeah, basically after the 3 uses or the reconditions of the N95s, you have to discard them and throw them away.
Gotcha. And is that something that you discovered because of or during COVID? Had we been doing that before COVID, or is this some new process?
Well, I think it's a fairly new process. Vince Moffat, the CEO for Basin, he basically is very aggressive, and you guys have had him on the show numerous times and stuff. He came across this at one of his meetings, his virtual meetings, and he asked me, he's like, hey, let's get this involved with our company. And so we took the steps. And so we're actually send our product up there, our PPEs, the N95s, and get them reconditioned so that we have them secured for whatever happens down the road. Our numbers are going down now, but, we're getting ready to go into the flu season. So we'll see how that all works out too.
Very good. Well, thanks so much for coming on and giving us an update on all things safety. I know the lay folk, we might not know what all goes on behind the scenes in keeping us safe. And so, Deon, thank you for coming on the show.
I appreciate it. Thank you, guys. And I think my contact information will be on there if you have any questions about the Basin Guard or have just questions about safety in general and stuff. Just please reach out, because we're trying to be a very prominent leader in the community on different stuff that's going on with the COVID and other things, and so we take it with high regards on what we have to do and stuff. And so we just appreciate you guys sharing that information and sending it across the different social media platforms and stuff, because people have questions and they want to know what's going on, and it's just an uneasy thing. We're getting ready to start school, and the whole school year is getting kind of changed up again. We have a senior this year, and it's just totally devastated her. So we appreciate you guys doing what you're doing and stuff, and if there's anything that we can help as far as Basin community businesses, please reach out and let us know.
Sounds great. Well, Deon, again, thank you very much. Enjoy the rest of your day, and tell your senior to hang in there. And
Yes. I will tell her.
hopefully we can reopen some of these things if we all do what we're supposed to be doing, which is wearing our masks and being physically distant and doing all those things. So
Stay in the course.
stay in the course. That's true. So anyway, you had a story
I do have an interesting story.
about
As we
Something
know that I'm apt
about
to
the sports.
have the sports ball.
Yeah.
Neither one of us know much about sports, of course.
Surprise.
but- surprise! Surprise! Do radio people? Well, there are sports
Of course.
radio.
Well, yeah, of
broadcasters.
course
Anyway,
there are. Anyway. Yeah.
So
What'd you find out?
What did I find out? So obviously sports have been disrupted just as everything else has.
Right.
And you might have heard about the concept of these bubbles that players are kind of being relegated to living in a bubble.
Right.
Not a literal bubble, of course.
No.
Not like the Bubble Boy story, but
Right.
But anyway, the NBA is actually currently housed at Disney World.
Not a
Did you
bad
know
bubble.
that?
If you have to go to
It's
a
a
bubble,
pretty good bubble. I
you
know that you like the Disney World.
I do. Right.
I've never been, but
Oh.
well, I don't really want to go.
Really?
Yeah. Anyway,
Wow.
theme parks were never my thing, primarily because the germs as it was. So now it's just an
Well, now,
extra
right.
heightened germ situation.
True. But anyway, but that's why they have a bubble.
They have a bubble, and so teams are all staying there, and they're actually playing all of their games in this bubble. And so JJ,
So they've taken, just pardon me, but
Yes.
they've taken some hotels and put the teams in, and they can all be distant and get their own suite of rooms, whatever they want, right? And they play right nearby, and that's the bubble, right?
that's the bubble. So you don't have any plane flights. You don't have any staying in separate cities and then flying somewhere else. And
Right.
you're only sort of like exposing one stadium to the issue. And
Okay.
so JJ Redick, who is an NBA basketball player, has started a podcast during his time in the bubble.
Oh.
I mean, right. And I wonder, I actually
Sharing
haven't.
bubble insights?
Bubble insights from the bubble,
Yeah.
coming live to you from the bubble. So that might be interesting for folks, especially who are interested in sports and NBA basketball in particular. And I actually have been wondering, how has the amount of podcasting gone up during pandemic times?
Right.
Probably.
I'm not sure. I don't know. We've heard that radio listening, unfortunately, has gone down because people aren't commuting because they're working from home.
Yeah.
So, not that we have a lot of commuters in the greater Farmington area, but I know we have folks from Durango that drive down here or drive back and forth, and that would be a commute that maybe people would listen to the radio or a
Right.
podcast. And if you're not doing that, that impacts a little bit about your favorite local radio station.
Yeah, I was just thinking about all the people who are quarantined who might be like, I've always wanted to try my hand at a podcast.
That's true.
So
true.
easy to do.
That's true. In fact, we have plenty at ksje.com.
Correct.
Podcasts. So there you go.
There you go.
So you can check
Tune
it out,
in.
everybody. So,
Tune in.
Exactly.
So that's an interesting story.
Okay. Well, from the bubble, we'll have to listen to it.
Yes,
what
JJ
he's-
Redick from the bubble.
Okay. Well, that is our program today, everybody. Thank you very much for joining us, and thanks to our guests. We definitely appreciated Nichele Salazar from the San Juan Health Partners Midwifery Women's Health Clinic calling in, and also Deon Brown from Basin Health Companies. I think that was fascinating.
It is.
Right?
Both of those interviews were
Whenever
great.
I talk to one of these cleaning people that does this for a living, I feel like I should go home and really clean my house, that I do not do a good enough job.
You probably don't.
I probably don't. Yeah.
I mean-
But anyway, I'm inspired.
Yeah, you should be.
So there you go. All right, everyone. We'll be back with you, of course, on Thursday. Don't forget, of course, at 9 a.m. on Facebook and YouTube. And again, a rebroadcast at noon on KNMI Radio and at 5:06 p.m. here on KSJE Radio. So we will see you back here on Thursday, everyone. Thanks for joining us.
See you later.
Yep, there you go.